morning. How are you doing today?
Good, how are you?
Good. Nice to meet you. So, what seems to be the problem? What brings you in today?
I've just been having a pain on the bottom of my left foot.
Oh, really? I'm sorry to hear that. So what was it that kind of caused this? When did it start?
It started about a week ago, just when I'm standing on my feet for a long period of time, walking around, especially in the morning, is when it hurts the most.
Okay, so that's what makes it worse. Where on your foot does it hurt?
On the bottom of my heel, just right here on my foot.
Okay, and then you said it's been lasting about a week. So how do you describe the pain? What it was like, dull, throbbing, stabbing, aching?
Yeah, probably like a stabbing pain.
Okay, and then you already said some things that make it worse. Is there anything that you can do that makes it better?
Rest, ice. I've been taking acetaminophen periodically just to help with it.
Okay, that's good. And then would you say the pain kind of spreads, or does it stay in the same area?
I'd say it's localized. It doesn't move anywhere. It's just there.
Okay. Is there a specific time of day that it feels worse?
Yeah, especially in the morning.
Okay. How would you rate the severity out of 10?
When I'm walking and have pressure on it, probably like an 8 out of 10. It's hurt pretty bad. And then resting just like this, maybe like a 2 out of 10.
Okay. So now I'm just going to ask you some more questions about your past medical history to get a better idea.
Okay.
Have you had any recent hospitalizations, surgeries, transfusions?
No.
Are you all up to date on your immunizations?
Yeah.
Have you had any serious childhood or adult illnesses?
No.
Are you currently on any medications?
No. Well, actually, I am on my birth control, low estrogen Faye, but that's it.
Okay. And then do you have any allergies to any medications that you're aware of?
No.
Okay. And then just talking to you, I can tell that you're alert and you're aware. Do you have any past family history diseases like your parents, grandparents?
Yeah, my dad, he has hypertension and type 2 diabetes, but he's the only one.
Okay. And so as far as your social history goes, do you have, how many hours of sleep do you get per night, would you say?
Like 7 to 8.
Okay. And then do you smoke, or have you ever smoked or used tobacco?
No.
What do you do for work?
I am a respiratory therapist in the hospital.
Oh, wow. That's cool.
Thank you.
Would you say that you get exercise pretty regularly during the week?
Yeah, I try to get like 3 to 4 times a week, whether it's running, weightlifting, tennis, things like that.
That's good. Sounds like you're pretty healthy. Have you ever used any illicit drugs, or are you currently?
No.
That's good. Do you drink alcohol?
No.
How do you describe your diet?
I'd say it's pretty healthy.
That's good. Do you have any pets?
Yeah, I have one dog.
Okay. And are you currently married?
Yeah, it's just me and my husband.
Would you say that you have a monogamous relationship with him?
Yeah.
And do you practice safe sex?
Yes.
And have you traveled recently out of the country in the past year or so?
No.
Okay. So now that we've gotten through all that, we can start the physical exam. So let's see how it looks. So I'm just going to have you roll up your pant leg so I can examine everything. We're going to start out with the vascular exam. So first of all, I'm going to check for a few pulses. We'll start out with dorsalis pedis, which is present bilaterally and graded at 3 out of 4. And then posterior tibial artery, palpable bilaterally, graded also at 3 out of 4. And the popliteal artery, which is palpable bilaterally and graded at 2 out of 4. Skin elasticity and turgor both look good. Capillary refill time. Less than 3 seconds bilaterally. Doesn't appear to be any edema, no varicose spider veins. Hair growth is normal and present on both legs and feet. Dermatological exam, feeling for any palpable masses, looking for any hyperkeratotic lesions, pigmented lesions. Look at the plantar side, both feet. Okay, everything appears good. Looking for any macerations in between the toes. Everything appears healthy. Toenails all appear healthy. Let's see, now what we're going to do is we're going to move on to first of all, let me check the temperature, sorry. Warm to warm, so no change in temperature in the legs. Now we're going to move on to the muscular exam. So what I'm going to do is I'm going to press on your feet and you're going to press against my hand. So lift your feet. Okay, now push them down, push them out, push them in. Okay, so I noticed a little bit of weakness when you were trying to lift up your left foot.
Yeah, it hurt a little bit when I was pulling this way with my left one.
So I would rate all of your muscles as 5 out of 5, except for dorsiflexors of the left foot. I would rate 3 out of 5 due to the pain. Now we're going to check some ranges of motion. First ray range of motion, within bounds on both sides. Mid-tarsal joint. Okay, appears to be within bounds on both sides as well. Subtalar joint, place it in neutral. Inversion, eversion. Ankle joint, dorsiflexion, plantar flexion. Inversion, eversion, dorsiflexion, plantar flexion. Now we are going to do the silver scale exam to check for any presence of equinus. Dorsiflexion. Okay, now I'm going to have you bend your knee and lift your leg up. Dorsiflexion. Perfect. Dorsiflexion present with both. Okay, dorsiflexion. Bring it up. And okay, dorsiflexion appears normal with the knee both bent and straight, so no presence of equinus is detected. Now what we are going to do is we're going to do a neurological exam to check for any damage to your nerves. First of all, I'm going to do the Semmes-Weinstein monofilament test. So I'm going to poke you with this instrument. It feels like that with your eyes closed, and you're going to tell me yes when you start to feel it.
Okay.
Okay?
Yes, 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 yes.
Okay, so Semmes-Weinstein monofilament test is detected on bilaterally, 10 out of 10. So now what we're going to do is we're going to check for vibration sense. Same thing, I'll have you close your eyes and you'll tell me when you start to feel the vibration and when it stops.
Okay. Yes, stop. Yes, stop. Yes, stop. Yes, stop.
Okay, perfect. So vibration sense is intact bilaterally. Now we're going to do sharp versus dull differentiation. So I'll have you close your eyes and you'll try and tell the difference between this sharp sensation and this dull one. So
Sharp, dull, sharp, dull, sharp, 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 dull, sharp, dull, sharp, dull.
okay, so sharp dull sensation is intact bilaterally. Now we're going to do a proprioception test. So I'm just going to have you close your eyes. I'll grab one of your toes. You'll tell me which toe I'm grabbing and whether I'm lifting it up or pulling it down.
Okay. Fifth, up, down. First, up, down. Fifth, up, down. Second, up, down. First, up, down. First, up, down.
Okay, proprioception is present bilaterally. Now we are going to do a reflex test for your patellar tendon reflex and your Achilles tendon reflex. So first of all, we're going to do the patellar tendon. So just relax all the muscles in your leg. Okay. Perfect. Now we're going to do the Achilles tendon reflex. So let's see. Perfect. Okay, now we're just going to do one more test on you. I'll just have you sit down, and we're going to do what's called the Babinski reflex test. So I'll have you lift up your feet one more time, and just relax your feet. Okay. Perfect, so we have a negative Babinski test on both sides. Everything with the neurological exam appears healthy and intact. So now finally we're going to examine the area of concern. So let's see. So looking at it, it does appear to be inflamed. And does it hurt when I press down on it?
Yeah, it hurts when you push on it.
Okay, so based on what you've told me and what I've heard and what I can see right now, I would say that you most likely have something called plantar fasciitis. It's very normal, especially among active people like you. So just to kind of rule out a calcaneal fracture, which I don't believe that's what it is, but we're going to get a radiograph just to kind of rule that out just in case.
Okay.
And in the meantime, what we're going to do is I'm going to give you some ibuprofen that you can take as needed depending on how bad the pain is. And if it does turn out to be plantar fasciitis, I think what we're going to do is I'm going to give you a cortisone injection to help with the inflammation and the pain.
Okay.
And for a more long-term solution, what I'm going to do is I'm going to teach you some different stretches and exercises that you can do to help to release the tension, strengthen the plantar fascia, and make sure that this kind of injury doesn't happen in the future.
Okay.
And I'd also like to, if possible, plan a follow-up appointment with you so that we can kind of see how the treatment's working and see how you're feeling. So is it okay if we plan something for about 2 weeks away?
Yeah. Yeah.
Okay, perfect. Do you have any other questions, concerns, or things you'd like to bring up?
No, that's everything. Thanks.
Okay, sounds good. Well, it was nice to meet you, and hopefully we can get that worked out.
Okay, perfect.